This is wound irrigation and dressing change. Start off, we would review the patient's health record, the prescribed wound care, or the plan related to the wound care. After that, we'll walk in, perform hand hygiene, wash hands for 20 seconds, singing ABC's or Happy Birthday song. Then you would want to assemble your gear, everything that you're going to need for the wound irrigation and wound dressing. After that, we're going to close the curtains, possibly close the door if we can, just to provide privacy for the patient, and then explain to the patient what we'll be doing to them today. And then next, we would assess the patient's possible need for pain medications, just in case. We assess the level of their pain at the current state, and if they need it, administer the drugs, make sure it's the right drugs, and then wait till the drug is effective on the patient, and that's when we can continue our process. We would also want a waste receptacle to throw away anything that we have and not leave any clutter. Then we also want to adjust the bed to the appropriate height level, at least to your elbow height is usually the best height. And then we would assist the patient to a comfortable position that provides an easy access to the wound area. We also want to be able to position the patient so it's easier for irrigation, or for the flow of the solution from the clean end of the wound towards the dirtier end, or top to bottom. We also place a waterproof pad underneath the wound site just so everything doesn't get wet. Everything gets put on PPE, put on off. We can move on to the gown, your mask, goggles, and then your gloves. In order to do that, we have to put on. We start with the outer edge of the dressing. Use a push and pull method, where you push down the skin and then pull up on the dressing towards the grip of the hairs. And after removing the dressing, we have to note the presence, the amount, the type, the color, and odor of any drainage on the dressings. Then dispose of it in the appropriate waste receptor, of course. After that, we would assess the wound for appearance, the stage, the presence of eschar, granulation tissue, epithelialization, undermining, tunneling, necrosis, sinus tract, and draining. After that, we'll also assess the appearance of the surrounding tissue, make sure it's all healthy. We can also, and then we also measure the wound, which this could be very helpful. But you could use this. Yeah. And then after that, we want to remove our gloves. We remove our gloves. Throw them away in the receptor. And then from here on, and then from this point out, we're going to have to create our sterile field. Sterile field, I want to show the patient, open towards them. Pick this up, throw this down, don't let it touch the ground like I just did. And then you kind of not want to grab it, and then put it down. And make sure nothing touches it. Okay, that's perfect. Next, we want to, all the equipment we'll be using, show the patient, grab by the edge, dump it. We could use this later. We could use this as the basin. And also empty these out as well. Towards the patient. Throw this out. We will put on sterile gloves. Make sure nothing touches our sterile field. Keep an eye on the sterile field. It's okay if this touches right here at the edge, is our 1-inch border. Pick up the gloves. Leave it like that. The inside of this cuff. Put your hand in. Make sure where the glove touches you. And then we can adjust the other glove. Okay, I have our sterile field here. Gloves. At this point, my workbench will be on my right side, my patient will be on my left, just so I can move everything around easily. One hand's going to be non-sterile, one hand will be sterile, just so you know. At this point, my non-sterile hand will pick up the basin, adjust it next to the patient, right where the drainage could happen. Pretend we'll be doing that. Make sure that at this point my left hand is non-sterile. So I put that next to the patient. And then I'll pick up this syringe, keeping everything sterile. The bottom is sterile. I would fill up this thing with saline, and I'll fill it up with saline. I'll fill up my container with saline. I'll fill up this container with saline. Pretend for now. And then my basin is next to the patient when I start irrigating the wound. At this point, we will fill the syringe with saline and get it ready to irrigate the wound. Using my non-dominant hand, I will gently apply pressure to the basin against the skin below the wound to create a seal with the skin, basically, so nothing drips down or anything. And then I would direct a stream of solution into the wound. Keep the tip of the syringe at least 1 inch above the upper edge of the wound. You don't want it to touch it. I don't want anything to happen, so at least 1 inch above it, and spray it downwards. So basically at the upper edge, so it all goes down to the bottom. And then when we know to stop is once the solution comes out clear, so everything starts coming out clear, and then once the wound is clean, we have to dry the surroundings. We can use a gauze sponge to dry it up, and we can clean around around the After I'm done irrigating the wound, I'll remove these gloves, don another pair of sterile gloves. In order to do this, I have a brand new pair of gloves. We use gauze. We use gauze. Soak it in saline. Alright, now in order to apply new dressing, what we would do is we would soak up these gauze, create sort of a fan-like thing, a fan-like structure. I'm not too good at it yet, sorry. Let's see. Basically, it'll be fan-like and need some practice. And then we will use a sterile cotton and just stick it into the wound and just keep undressing and keep unwinding the fan-like gauze and just stuff it in. Basically, make sure to fill it but not extruding out of the wound. And after that, we would remove everything is non-sterile. We use a dressing. We will now use an abdominal pad. After that, we'll pick up our abdominal pad. We want the blue side on over the wound, and just place it down. Just place it down with the blue side up over the wound, and just tape it up. Apply tape or Montgomery straps or roller gauze. Really depends on what you want. After securing the dressing, we will have to label it, date it, and time it. Now we'll clean up everything, remove any other equipment, return the bed to its lowest position. Make sure the patient is comfortable, and we can remove our PPE. And to do that, start off by removing the front tie. Front tie, gloves, gown, and then walking out the door, mask, and glove, and eyewear. And that is basically it. And then we also check all wound dressings at least every shift. And that is all.